Welcome to another episode of Heart to Heart, where we speak with cancer survivors about their experience managing both cancer and cardiovascular complications that sometimes can arise during or as a result of cancer treatments. This particular episode is being sponsored by one of our partner organizations, the Healing Works Foundation. The Healing Works Foundation mission is to make whole person integrative care regular and routine for all cancer patients and survivors. You can find more information about Healing Works Foundation in the show notes at the end of this episode. Today we bring you another compelling and hopeful story related to the cardiovascular care of patients with cancer. And I'm here with my co-host, president of ICOS, Dr. Susan Dent. And today we're so pleased to have with us another cancer survivor, Francesca Ossani, and one of her treating physicians is joining us today. So we welcome also her cardiologist, Dr. Francesca Cribari, right? Sorry. Thank you both for joining us today. And we're really looking forward to this conversation. Francesca, I wonder if I can begin with you and just have you tell us a little bit about who you are, what your life was like leading up to your initial cancer diagnosis and how that came about.
2 years before discovering my illness, I went through a very stressful work period that pushed me to my limits, really to my limits. I had lost 7 kilos in just 2 months, and I was very, very tired. I underwent several checkups, but I had overlooked the breast because I had already done a mammogram in January. Just 4 months later, I discovered a lump in my breast.
And then what was the specific diagnosis that you received at that point?
It was about a year ago when I found out I had a breast cancer. There were 3 lumps, 2 on the left and 1 on the right. And most importantly, 2 different primary tumors. I immediately underwent a bilateral total mastectomy, 6 surgeries in 9 months, and yet the wonderful thing is that I was able to live through it in the best way possible. I discovered that despite the pain and the fatigue, this was perhaps not only the hardest year, but also the most beautiful year of my life. I learned that life is only one, that it has to be lived fully, and then often the real problems are not the ones we think.
Francesca, maybe you can tell us a little bit about what kind of systemic therapy you received and what symptoms led you to think there was a problem with your heart.
I did Taxolo, the chemotherapy,
Mhm.
and I did the trastuzumab. And it was the trastuzumab for 1 year, every 3 weeks, and the Taxolo for 3 months, every week. Along the way, I had some problems with my heart during treatment. I was feeling a bit more tired and short of breath than usual. I started low dose of bisoprolol and ramipril. My symptoms disappeared, and I was able to continue trastuzumab safely. I understood this time how valuable is to have oncology and cardiology working together.
And Francesca, along that, you said that you received the Taxol and the trastuzumab and that you started to become symptomatic. Did your oncologist refer you to cardiology during your treatment? Is that how you were started on those medications?
Because I normally every 2 or 3 months, I did the control with the cardiology. So I explain, in this case, to Francesco, all my symptoms, and he helped me.
Well, we're really fortunate to have your cardiologist joining us today online, Dr. Francesca Cribari, Could you comment maybe just on your experience in working with the oncologist and the interaction and the importance of that in terms of allowing Francesca to complete her prescribed cancer therapy?
Thank you for the question, Susan. So we're halfway through Francesca trastuzumab treatment. We're about 6 months in, I would say. And during our second planned visit, she started reporting me a mild dyspnea and fatigue. I performed the follow-up echo and I observed a decline in her left ventricular systolic function from baseline of 60 down to 48, 49 with a concurrent reduction of GLS, a global hypokinesia, and a raise in NT-proBNP. Later, we obtained a coronary CT scan to rule out ischemia, but the pattern was frankly unmistakable. She had a moderate cardiac dysfunction related to trastuzumab. And in that moment, everything prompted an immediate discussion with the oncology team. We decided to tighten up the cardiac surveillance at shorter interval and to start cardioprotective therapy right away with ramipril and bisoprolol. Knowing that at this stage, we're roughly 6 months away from completing trastuzumab course, and stopping prematurely could have compromised oncological efficacy. And from that point on, every decision was always fully shared. We put the numbers on the table, acknowledge uncertainties, and we agree on a clear plan, establishing threshold that would trigger a pause of trastuzumab. And in that context, Francesca's voice was central. She understood the cardiac risk, but also knew that everything would have been under close and strict control. She had my personal home number and could reach me anytime, and that built the trust we needed to get through it. Knowing how heavily a cancer diagnosis can weigh on morality of a patient, and any setback can even feel even more overwhelming for the patient. But thankfully, Francesca was amazing, and she is incredibly tenacious. So in coordination with our oncology, we decided to continue trastuzumab under what we often call in cardio-oncology that famous permissive cardiotoxicity, that it's a fascinating concept, precisely because it's so counterintuitive. For a cardiologist, I would say that the idea of continuing a drugs that is clearly stressing the heart, I would say that feels almost paradoxical, and yet when carefully managed, it can be the right call for the patient. So despite the EF drop, Francesca always remained stable. The symptoms were limited, and we believe that there was enough room for a recovery. She tolerated treatment well, completed the full course of trastuzumab, and in the end, we achieved a full recovery of left ventricular function with a normalization of biomarker and strain. And for us, that marked a complete success.
I think this is so important what you've mentioned. First of all, just the interaction between the oncology and cardiology team here was so important so that Francesca could complete her therapy. The second thing I think that's really important to note is that, she had trastuzumab and Taxol, so she did not have anthracyclines. We always assume that patients have anthracyclines are the ones that are going to have problems, but it doesn't have to always be the case. And in this case, it was just a trastuzumab and Taxol. And then thirdly, the idea that you mentioned of permissive cardiotoxicity. There have been, as you mentioned, a few actual clinical trials that have looked at the safety of giving trastuzumab in the setting of reduced left ventricular ejection fraction, showing that with close monitoring, as was the case with Francesca, that you can accomplish completion of the cancer therapy. And there are ongoing trials, one called Scholar 2, looking at this in a prospective fashion. But I think this concept is relatively new, but so important for individuals so that they can have the benefit of the modern cancer treatment. Francesca, can you tell us a little bit about this challenge and what it meant to you and how you maintained hope along the way as you were going through this journey? Because not everyone experiences this, but you obviously had a team working with you to try and help you through your journey. So what was that like for you? How did you sort of keep moving forward? Were there any sort of things that helped you get through this time when you were worried about your heart health and working with the cardiology team to try and make sure that you could
Okay.
complete your cancer therapy?
On this part, I was lucky enough to meet amazing people who made the journey lighter and full of light. The incredible thing is that I also discovered the positive side of the social media. The day I shared my first post, right after receiving the diagnosis, so many people started following me and telling me about their own journeys. I shared every step of my chemotherapy. I realized that I was giving strength to those who were going through the same experience. I always tried to look at the illness from a different perspective, but above all, I always kept my focus on my goal, which was to heal. I told every step of my journey with great simplicity, without filters, and I realized that this very honesty opened a way into people's hearts. It was able to help so many people. I was able to help so many people. I never imagined I could be such a support to others. I found words of affection, closeness, and sharing that I never imagined I would receive. And the most beautiful thing was discovering that, thanks also to social media, a true network of support and love can be born.
I think that's really valuable for those who might be listening who are facing similar issues, particularly with regards to their cardiovascular health. So, moving forward, Francesca, tell me a little bit about what you're doing now in terms of volunteering. I understand you're now volunteering in a pediatric cancer center. Can you tell us a little bit about that?
Yes, cancer has changed me deeply. This is the reality. I am no longer the same person I was before. I have realized that it's possible to be completely reborn, really reborn, as if beginning a new life. My daily priorities have completely changed. I live each day in the present moment and appreciate everything that happens to me. I have learned to face challenges with much more lightness because I have understood that everything is destined to change. In January of this year, I finally fulfilled the dream of my life, becoming a volunteer in a pediatric hospital, Bambino Gesù in Rome. I spent time in the wards sharing my smile and my hugs. I received so much from the children and their parents, far more than what I give to them. When I leave, I am so happy that I feel like I could fly.
That's wonderful. That's just a wonderful thing to hear. I want to ask Dr. Krabari, can you just comment on the value of working in collaboration with oncologists in individual cases like what Francesca faced? I think that we talk about it, but we know globally that communication doesn't always happen. But just some of your thoughts around the importance of this collaboration.
I think cases like this are exactly why cardio-oncology exists. Because in this case, what made the difference for Francesca wasn't a single intervention, but it was how we worked together with the oncologists. We didn't run in parallel tracks. The oncologists trusted me enough to slow down when the arcs started drift off. And I trusted them enough to keep pushing when the cancer still needed it. And that kind of balance doesn't happen by email. It happens in real time, in late night phone calls, in shared silence when no option feels perfect. Because in cardio-oncology, when you truly understand what's at stake on both sides, cancer and art, no option never feels completely right, in my opinion. And above all, it has to be an ongoing dialogue, sustained for as long as it takes, for as long as the patient needs it. And we often talk about multidisciplinary management as if it were just a procedural formality, but in the real world of cardio-oncology, it means shared responsibility. And thanks to that, Francesca never had to choose between her heart and her cancer. She had a team that refused to make her choose. And I think that's the most important things about cardio-oncology, at the shared management of oncologists and cardiologists of cancer patients.
I absolutely agree. And I think what we have realized in cardio-oncology is that many of the answers are not in a textbook, nor are they answers that we'll find in a manuscript, but we are learning as we go along. And as we learn, and of course, we need studies, prospective studies, but a lot of the management strategies have been through collaboration with our colleagues and where we try and come up with a reasonable approach. But what I really like that you said today is that Francesca didn't have to choose between her cancer and her heart. I think that is just really the crux of it right there, is that we want the best cancer therapy without compromising cardiovascular health. But how can we have the balance between the both? So, Francesca, I wanted just to go back to you for a minute. Having gone through this treatment and this journey and come out the other end essentially doing quite well, what would you like to say to those who might be listening to this podcast who are facing a similar issue or who are at risk of cardiovascular issues? Any idea, any pearls of wisdom or things that you can share with those individuals?
Okay, the important things is that every person had to understand that side effects during treatment vary from person to person. They can be very difficult to overcome, but thanks to modern therapies, there are great chances of recovery. I believe the most important thing is to communicate openly with your oncologist and cardiologist in order to manage side effects in the best possible way.
I think what you raised is so important, communication. Also, patients understanding the side effects of treatment. And I think that we try and do that, but that is so important to understand the potential toxicities from treatment so that we can be more proactive in trying to prevent some of these issues, particularly, of course, when it comes to cardiovascular health. And that's why you were having the heart imaging and the echocardiograms done while you were on treatment. And importantly, dealing with it when it happens. So traditionally, when you saw that drop in left ventricular ejection fraction, we would have stopped the treatment and held it and maybe not restarted it because oncologists were concerned about the impact on your heart. But what we've heard from Dr. Kribari and what we know now is that actually working collaboratively together with cardiology, we actually can try and manage the cardiovascular health while you're completing your cancer therapy. And I think that is such a key message. Francesca, can you just update us on where you are now? Are you in terms of being no evidence of the disease coming back? And where are you in your life right now?
Through my cancer, I experienced many emotions: anger, sadness, fear. There were all valid emotions to feel, but it was in that very moment that I realized I had to step into my emotions and move through them. I understood that cancer wasn't something I had to fight against, but rather something I had to walk hand in hand with in order to understand the message that life was trying to give me.
And I think, Francesca, what we've heard today is the team, that it was a multidisciplinary team that was looking out for your best interests and for treatment of the cancer. And traditionally, medicine has in the past been somewhat isolated. Have worked in silos. I think increasingly what we're recognizing is the importance of working together, that we have to treat not just the heart and not just the cancer, but both. And we do that by breaking down some of those barriers and by communicating with each other as both disciplines of cardiology and oncology, but also including in there nursing, pharmacy, exercise physiologists. We realize now that we need to take a whole person approach, not just looking at the disease, but treating the entire individual. And I think this is what you have really highlighted today, is the impact of this cancer diagnosis. It changed your life, that now, hopefully now you're actually enjoying it, you're volunteering, sounds like you're doing very well. And importantly, your cardiovascular health has not been compromised and you were able to complete your cancer therapy. So, Francesca, as we conclude this podcast, any last words for our listeners today?
I want to thank Francesco because he was really near, very near with me. And another important thing is that oncologists and cardiologists and all the person who works with the person in oncology, they have to be very empathic. And the important thing that every person can see every patient like a person with all the emotions, with all the problems, and everyone is different from the other one.
Wonderful, wonderful words. And Dr. Kabari, do you have any last words for our individuals listening to this podcast?
Volume.
Thank you for the invitation. And it was great to express and present to you this case that really summarized my experience in cardio-oncology and somehow underline how we need to push the boundaries. Because in other cases, that treatment would have been interrupted right away. And we have to push through the patient of oncologist enough to keep the trastuzumab ongoing for as long as Francesca could have tolerated, or for as long as Francesca would have needed to undergoing the treatment. So I think this team is a gigantic team to express, because we really need to start pushing those boundaries even more than we have done for now, even more than what the guidelines recommend to us, because the cancer and the heart needs to be protected and taken care as at the same manner as long as we could potentially do it.
Absolutely. So I want to thank both of you for being willing to share with us your experiences and your thoughts. The International Cardio-Oncology Society, as you know, is dedicated to ensuring all cancer patients receive the best possible cancer therapy without compromising cardiovascular health. And it really focuses on working together collaboratively so that we can do both of those. And we do not like to hear cancer patients not receiving cancer therapy because of cardiovascular issues. So thank you, both of you, joining us today. This has been a great experience listening to what you've gone through and how you've worked together collaboratively as a team. And Francesca, I wish you all the best in the future. It sounds like you're doing great. And I'm so happy that you're able to give back to the community and that you were willing to share your experiences today with us on this podcast. Thank you.
Thank you,
you.
Susanna. Thank you. And sorry for my English.
Your English is better than my Italian, so
Okay.
don't worry. Which is nothing.
Thank you very much, Susanna.
Thank you.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.